Good morning, everyone. Welcome to Dealmakers Table with the healthcare series. Today, we have Shane Leonard on the podcast. Shane, thanks for joining us today and discussing a critical topic in healthcare, rethinking staff, resident, and patient retention strategies, given the labor market is so tight currently and hard to find good people. With your extensive experience leading, Action Recovery Center and the Wall. What are some of the most significant shifts you've observed in retention challenges over the past few years?
Well, COVID was a huge driver of that, of course. The travel nurse positions, they were much needed, but very unrealistic in sustainable pay structure. So as that as that number comes down, as things normalize, I should say, um, it is making it easier.
That's great. The patients definitely need it, right? Without the staff, you can't support more and more patients. So, in our conversations, we've talked about you're successfully growing into Action Recovery Center significantly, very high occupancy rates, even in that challenging environment. So, what are the core philosophy guiding you and your approach to building and maintaining that strong community, both for your staff as well as your patients and clients?
Well, I've been in business for myself for 31 years, and a lot of that was in mid market, uh, no tech, no brick and mortar things. And so it wasn't really important that Into Action make a lot of money for me. I wasn't looking for a return on investment. I was doing it because I had a great passion to help others. And fundamentally, that's the case with probably every single treatment center in the country. There's somebody there trying to do good work. Um, and so we start off with that basis is we all are one team. It's one culture that has one message, and that's the message of hope. Uh, our own personal experiences. Now, not everyone here is in recovery, but 80% of our employees are. So that's about 120 people. And so you add all those years up, that's a lot of years and a lot of different experiences. Every every stone that could be unturned's been unturned amongst the staff. And so it's really just creating a culture that uh, lends itself to people that want to help without being uh, having guardrails on compliance things. Not that we don't, just them. Not overburdening staff with administrative tasks associated with what we do.
Oh, that's great. What a fantastic mission and passion, right? That's one of the things that drew me to my profession, prior to pivoting here is, being in healthcare and helping patients. Certainly an easy way to get up in the morning to know that you're going to be, impacting someone or some more people's lives. So, with that and your staff retention strategy, it's, a large part of it seems like you built a great culture as well. Um, so, what is one of your biggest challenge for growth? You mentioned that in our previous conversation is finding and retaining that good people that you can trust, right? Maybe using some words that we discussed before. So, you mentioned a little bit of what you've done. So, what specific strategies have you implemented to attract and keep that high quality staff in a competitive healthcare labor market?
Well, we became a clinical training institute licensed by the state of Texas. And with that, it allows us, once somebody is, the state of Texas has a law that says that you cannot hire someone until they've been discharged from your program for 24 months. Well, a lot of those people really find their purpose, and that's helping others. And they want to choose that as a vocation. Some want to start off at the very lowest level, which is none of it's low level, mind you. I think it's quite heroic when people go through addiction and then make this their life's work. Uh, but people that want to take the licensed chemical dependency counselor track, or we have a lot of people that come through here that are fully educated in an entirely different discipline, and yet they choose to go back to school. So by the time they do that, and or just on a alumni basis, if they stay around long enough, then we know that's a keeper for sure.
No, that's great. So with those high demands on healthcare professionals, we talked about the culture, right? So what role and how do you maintain that culture in, preventing burnout and encouraging that long-term commitment for your team members?
Blaine, used to when we were very small, we had this little deal where we would just tap each other out. If it felt like somebody was getting a little too burnt out and having a little sympathy fatigue, we would just tap them out and somebody would join in. And we still do that, but just not in that format. So uh, we try to. I have a wonderful senior management team. Uh, and we all recognize that as leaders of the organization, it's incumbent on us to make their lives easier, because they get the really hard work. They do the heavy lifting here. So the administrative burden's easy for us to maintain and keep up with, and not really expose them too much to it other than what's germane to their position.
I like the idea of tapping the tap out, right? It's such a great analogy. So, kind of pivoting from the staff now to your patients, um, you highlighted the importance of, meeting the patients where they're at, either that's physically, emotionally, financially, spiritually. How does that philosophy translate into practical strategies for retaining, those patients through their recovery journey and possibly care afterwards?
Well, the short answer to that, Blaine, is by doing it. Just simply doing that. And for those that don't know what that means, is you'll look on a lot of recovery centers, a lot of behavioral health, and they'll say that, and they'll say that we meet our patients where they're at, emotionally, physically, spiritually. Well, all I know is that we do, and if that's meeting them, uh, with a work payment agreement to facilitate them coming in, whether it be picking them up from the hospital. The family reaches out to us, they're in the hospital. It's always my recommendation and suggestion, let us go get them, because the families need a break too.
Yeah.
So we meet our patients in many different walks of life. It's not just there's no one. And it really is, Blaine. By the way, it really is a very unusual business, if you want to call it that way, and it certainly has become such. But it's the only business I've ever been involved in the past 31 years that there's really no direct market to go to. So that makes it a little more difficult. And so I firmly believe, I wholeheartedly believe that everyone deserves access to the same health care, especially in our country. And we take marketplace plans, and we take, the most elite anthem, empire policies. It just doesn't matter to us. Number one, you can't see through the phone, and I'm sure glad you can't.
No, it's really rare that you get personalized medicine and treatment. And it sounds like, you and the team and the culture that you've provided certainly does provide that. And I'm sure that has a large impact on, those recovery rates and continuous, cracking to the program. And you mentioned, after the program's over, you have, structured sober living options as well. And how does providing those additional options for aftercare improve the long-term patient retention and recovery rates?
Well, just the nomenclature is kind of difficult anyway. I really don't like the word sober living because it conjures up a halfway house
Right, right.
or something like that. But if you church it up a little too much and call it extended aftercare, then you might be missing the mark. So it is sober living in essence, in reality. And the importance of that is, man, anyone can stay sober in a treatment center. I could stay sober in a treatment center. There wasn't happy hour, there wasn't drug Thursday, you know. It's what you do when you get out. And it again, my own personal experience and everyone that I know that I have 16 and a half years sobriety. Anyone that I know that has real sobriety, real recovery, doesn't just mean being abstinent from their drug of choice. Uh, it, it it affects every aspect of their life, and the only way that you can get that is just practice, practice, and progress, and that's it. So it allows for that. We make it very economical. I mean, $125 a week to live in one of our houses. Uh, I can assure you that is not. If I had to parse that out, if I ever needed to go get a loan, I wouldn't use that because that's a lost leader, so to speak. But it's not a lost leader; it's a gain leader. The longer you can get people to stay, particularly people that have suffered with addiction for 5, 10, 15, 20 years, have failed treatment multiple times, is make that look good too. So we bring all of our clients at some point in their stay for a tour of our sober living. Because just like me, everyone has it in their head. All I need is 30 days. And whoever picked that number, the only science behind that number is terrible.
Yeah. Well, speaking about, maybe not so good outcomes or participants, if you will, there's some patients that I know that you deal with zero deductible insurance plans, so there's no skin in the game, if you will. How do you balance your long-term goal with those clients and ensure that they're engaged through that recovery process? Is there a strategy you and the team use to maybe flip their script? It's like, they're just in here using the system versus I'm really here for recovery. So how do you deal with that situation, Shane?
All and all of that is individually, whatever those people need to hear or need to see. We try to get that message across to them. And the key to all that is the people that we feel like are really not all that willing. It's pretty obvious when you do their screening. Uh, there's no real crying out for help in that. And but they do qualify. We do bring them in, and we do a lot of motivational interviewing. We do a lot of team building. We do a lot of unorthodox things in terms of sometimes when a guy wants to leave or a woman wants to leave, a male staff member, including myself, or a female staff member, we'll just take them off site and go get them a hamburger and just visit. Um, and it gets to that level of meeting them where they're at. Uh, but I think that the insurance companies, again, everyone in this is well intended because I don't think I know any one person that addiction hasn't touched their family in some way or the other. Um, but the pendulum tends to swing too far one way or the other. For example, in 2010, we were the first organization that even applied for a detox and residential license in 3 years.
Mm.
Well, now, there's hundreds in Texas.
Yeah. Well, speaking about Texas and reimbursement rates, I know that you face some serious industry challenges here, and with Medicaid reimbursement rates in Texas and the payment challenge with insurance companies as well. I know that's the administrative part, and the team and yourself do go through great efforts to shield, your patients from that and work with those providers. But how do those pressures influence your ability to, keep patients, and, what solutions have you found to mitigate that impact, to your mission?
You know, things like doing this podcast, things like that, but having a platform in which to speak about these things, because the easy thing to do would be just to point the barrel of your gun at them and they point it right back. And you just end up in a circular blame thrower contest. And the real solution to me lies in more insurance company participation. Come out and tour. In 16 years, we've only had two companies come out and tour our facility, and that alone will sift out the bad actors, the people that are in it for the wrong reasons. And so I think more insurance engagement and less people trying to game the system. We're our own worst enemy in this industry. And so, how can you blame the insurance company? So, it's quite a dichotomy.
Yeah. Yeah. And you have to work with them, right? It's got to be a partnership and awareness of what's happening, and, voice of the customer, if you will. I mean, I really do wish more people would just get down to the, you know, voice of whoever the customer is and meet them so they understand what they're serving, right? And those two insurance companies, out of how many you're working with, kind of a low bar, right? You would wish that bar would be a little higher for sure. So,
Well, the
the
barriers to entry certainly are.
yeah, yeah. And you mentioned some of the other, private equity, firms, if you will, or other companies around you that prioritize, dollars over, the person, right? The patient. How do you and, Action Recovery Center maintain that mission-driven approach to retention when there are those other trends that don't prioritize the patient versus the almighty dollar?
Private equity, and I've worked with private equity uh, in the aviation business, and they're the smartest people on the planet, but they're pretty agnostic about what it is they're investing in. They're looking for that return, and and they're rightful to do so. But boy, if you try to run this like a manufacturing business, a widget company, anything like that, and apply the same. So it's counterintuitive to everything. I'm a businessman. So it's counterintuitive to everything we're taught as business people, but you just have to do right by the client, period. And the other stuff takes care of itself.
Yeah, I was on a podcast yesterday with another individual, and he mentioned that, the patients, all they want to have is one good reason to say, hey, it's you screwed up, I'm out of here, I tried, right? And, so you're going over and above, and you really are in it for the patients, and, is a what should be a universally applied way of thinking seems to be not so much, unfortunately. So you also mentioned, Newsweek magazine, right, ranking you in the top 2% nationally. I mean, that's a fantastic, um, recognition. 2%, pretty darn good in my mind. How did those external recommendations, accreditations help you, help the mission, help your team, help your occupancy rates, um, so on and so forth?
Well, I wish that, and we're an esteemed company on that list, by the way. And I wish that more consumers, more families, more individuals that are looking for that care were more informed about what a good treatment center is and what a bad one is. And so when you can just send somebody to a Newsweek magazine link for the past 4 years, and we show up consistently, it's a largely recognized name, way more so than Into Action Recovery Center. So it just validates that. they feel more at ease. But it's still peculiar to me that people will make a financial commitment over the phone that costs as much as a vehicle. Uh, so it's all I always recommend, and I tell every single person, and so does our admissions team, is that you be sure to tell them, here's some of the warning signs, not directed specifically at a treatment center, just our industry as a whole. If they're telling you something that's too good to be true, you have to pay your deductible. There's no way around that. Um, so why not be straightforward about that on the front side?
Yeah. Kind of switching gears and looking to the future now. What trends or technologies do you believe will be the most significant impact on your team, your residents, your patients, in the healthcare sector and the area that you guys specifically focus on?
Well, I used to be very closed-minded when I first got sober, and probably the first year or so that Into Action was open. I thought everyone had to get sober the way I got sober, and that's just simply not true. Um, so the challenges are, again, I already identified one. There's no specific market. You can go to Google, and you can go to Google, and we can all go to Google. And I'll give you just a ago. They sent a Harvard MBA guy down, and I just wanted to know a few things. And I said, that they are still a substantially large company. And I said, how many verification of benefits do you guys get every day? He said 1,500. We were just swagging it, just ballpark numbers. I said, how many of those people qualify for treatment and could be placed that day? He said about 1,000. I said, well, how many actually get placed? He said about 400.
Oh,
And so the magnitude of the waste and the marketing spend, and just when you look at, if you call a treatment center and their response is, we don't take that insurance, I'm sorry. Well, in Texas, we're required to give 3 referrals, and I'll give them 10.
then one of the other things that you mentioned, and we're hearing about it in the news pretty much every day, is artificial intelligence. And when we talked, you briefly mentioned that as well. How do you envision AI and any other technology supporting your mission, your vision, your team, the treatment people receive, and the broader healthcare industry?
Well, I'm not so ignorant. I'm fairly ignorant about those things, but I'm not so ignorant to know that it's coming. It's already here, and people misconstrue this. That's a pretty. That's a bombastic word, in my opinion. AI. It's just curated intelligence. AI just scans and gathers as much data as it can find on the website. And so it's not, I'm happy to do my own thinking, but how it affects is that they're able to uh, replicate your advertisements online. There's great things about it, but there's the potential for some really bad things about it. Now, the good thing about it is it's forcing us to get up and go out in the community and tell people what we're doing, and which I like that better anyway.
Yeah. So for other people, struggling with retention and keeping patients, away from their addictions, what's one piece of advice you'd offer based upon your extensive experience and success in this field?
You have to decide the things that are important to your mission, what you're trying to accomplish. The Clinical Training Institute was secondary, but also important to me. uh, because people in our field often have prior, the judicial, pardon me, with the court system, or they've been incarcerated for very benign things I could have been arrested for. These aren't hardened criminals, right? Um, is just stay true to your mission, and you can't serve too many people. You just have to stay in your lane and do that very well. Our core competency is in chronic relapse clients. Our core competency is in intervention clients, the worst of the worst, like me, people that just couldn't get it because they were just too smart, or what. It's just not that. I mean, when you're in your active addiction, all that stuff is very real to you. So there's some things that we do that other treatment centers don't, and some things they do we don't. Like cell phones, boy, uh, what a detriment to your treatment. You may as well not even go if you're allowed to have your cell phone.
Mm.
30, even 90 days goes by so quickly. You just don't need it. We let our clients have their phones when after they've completed 35 to 40 days, no sooner.
That's great. So, definitely a lesson learned, I'm sure, as technology has evolved too. It's like what works in the recovery center and what doesn't, right? And I can certainly understand how that could be a huge distraction and detriment for their complete and total healing. So, Shane, for parting thoughts, do you have any other thoughts? How can people get in touch, with you? What's their first steps? Um, how do they start their journey? And any parting thoughts that you might have for the audience?
Yeah, first of all, I love what we do, and I have 140 other people that love what we do. So although there's challenges, although there's difficulties, you know, you can't let that bog you down and prevent you from doing what it is that you want to in the field, because it is extremely rewarding. And this notion that the recidivism rate is 90%, that's nonsense. Uh, that's a fiction. That's a fictionary tale, just like the 30 days. Come to treatment for 30 days and we'll fix you. That's not the case. And just anyone that's struggling with mental health, substance abuse, it's not going anywhere. You need treatment, and it's only going to get worse before it gets better. So you can always call our admissions line. And I wasn't prepared to sell on this. I'm sorry there. I need to get the admissions number. Uh,
That's
we have
great.
uh, we have 24-hour, 7-day a week on call people. So you'll actually be talking to a live human being, and they'll make sure that they answer all your questions. And that person could very well be me on the phones. So I always like to, whatever it is I'm doing, I want to know every aspect of the operation. And as such, I did admissions for 4 years at one point. And I enjoyed it because we were able to help more people than that didn't come here than did, because we're not always the right fit for everyone.
That's great. Well, if you don't have the number now, we can certainly put it in the podcast description for later.
Yeah, sorry about that. Here's my cell phone number: 713-560-1223, or 832-224-4783. And one of our admissions counselors will be happy to help, and we'll go the extra mile for you.
Well, with that, I mean, you can't get any more personalized than that in my mind. Shane, very good conversation. Thank you so much for your insights. And hopefully, we can help one or more people who are listening here today. And help themselves, with the addictions that they're facing, and on to better and more productive living. So with that,
Well,
again,
thank you for having me. I've really enjoyed the opportunity to advocate for people and remove the stigma. We're not bad people. Uh, you know, diabetes is in the same line of disease as alcoholism. Well, you don't hardly, I don't think I've ever heard of one person getting divorced or their whole family being torn apart by diabetes. Um, a Milky Way can be just as dangerous as vodka.
absolutely. Well, with that, we'll close today. Thanks everyone for joining, and we will talk to you all later.
Thank you so much.